What symptoms do schizophrenia and borderline personality disorder share? Have you ever wondered how two seemingly different mental health conditions can share symptoms? Today, we will look at schizophrenia and borderline personality disorder, also known as BPD, to understand their overlaps. While these conditions are distinct, they do have some common symptoms that can complicate diagnosis and treatment. First, both schizophrenia and borderline personality disorder can involve psychotic symptoms. In schizophrenia, these symptoms are often more severe and persistent. Individuals may experience ongoing hallucinations, such as hearing voices or seeing things that are not there. Delusions or strongly held false beliefs are also central to schizophrenia. In contrast, people with borderline personality disorder may experience brief psychotic symptoms, like hallucinations or paranoid thoughts, but these are usually stress-related and not as long-lasting. Paranoia is another symptom that can appear in both conditions. Individuals with schizophrenia may develop fixed delusions about being persecuted or controlled by external forces. On the other hand, those with borderline personality disorder might experience paranoid thoughts, especially when they feel abandoned or threatened. However, these thoughts are generally less fixed and more reactive to emotional distress. Impulsivity is a feature seen in both disorders, but it tends to be more prominent in borderline personality disorder. While people with schizophrenia may show impulsive behaviors, these are often overshadowed by negative symptoms like apathy or social withdrawal. In contrast, individuals with borderline personality disorder are more likely to engage in risky or self-destructive behaviors as a way to cope with emotional pain. Another shared symptom is a sense of limited self-identity or chronic emptiness. People with schizophrenia may describe feeling hollow or detached from their bodies, sometimes as part of their delusional experiences. Those with borderline personality disorder often report chronic feelings of emptiness and may distract themselves through extreme behaviors. Cognitive difficulties, such as problems with attention, memory, and decision-making, are more closely associated with schizophrenia. While these symptoms are not a core part of borderline personality disorder, emotional instability in BPD can sometimes impact cognitive functioning. When someone with schizophrenia also shows symptoms resembling borderline personality disorder, it is essential for clinicians to assess the full range of symptoms. This careful evaluation helps ensure accurate diagnosis and appropriate treatment. Misdiagnosis can happen if overlapping symptoms are not thoroughly considered, as effective treatments for schizophrenia and borderline personality disorder can differ significantly. Understanding these shared symptoms is important for providing better support and care for individuals who may have both conditions or whose symptoms overlap. This knowledge is especially relevant in the context of schizophrenia and comorbidity, where the presence of additional mental health issues can complicate diagnosis and management. Awareness of these overlaps encourages informed discussions and highlights the importance of professional assessment for accurate diagnosis and treatment planning.